The common perception is that everyone with HIV should be on antiretroviral or ARV treatment, but this is not the case. ARVs are not effective once the virus has progressed beyond a certain point, which means that healthcare workers need to determine the strength of the virus before prescribing ARVs to patients. The Biotechnology Centre at Rhodes University is fast-tracking this process through science and technology. They are working on a faster method for determining whether or not HIV patients can be helped by ARV treatment. The progress of HIV is measured by the amount of CD4 cells in the blood.
So we want to see how many CD4 cells there are in here. So we'd want to see if there's less than 200 or more than 200, because if there's less than 200, it means the person has full-blown AIDS. And if there's more than 200, you're still healthy and you can take antiretrovirals.
Currently, CD4 cell count can only be determined after a few weeks. The new method would give results in 20 minutes. The virus progresses quickly without the presence of ARVs, so the time saved will be saving lives. Nationwide, it is estimated that over 6.1 million people are living with HIV, a large portion of whom should be on antiretroviral treatment. This new diagnostic technology will help healthcare workers at clinics and hospitals like Settlers Hospital to get medication to patients faster.
And a part of this whole model is that we are ultimately trying to develop products that will address real societal issues. So issues in the environment, or issues in healthcare, or water treatment, or even electricity generation.
The test uses a new color change reaction to show CD4 cell count in the blood using a sensor strip. A smartphone app detects the results of the color change and then determines whether the patient needs ARVs. The Biotech Centre has used 3D printing to create a device to aid the smartphone app.
So the idea behind this is that we printed this kind of generic smartphone cover that can actually function as a hood to allow for better imaging and better photography of the sensor strip. We can actually then get an accurate representation of the strength of the color.
A lighter color indicates the patient has less CD4 cells, which means the body won't respond to ARVs, while a darker color indicates more CD4 cells, meaning that ARVs will still be an effective treatment.
So it's portable, it's cheap, it's effective, and can be used at local clinics and facilities wherever the HIV test is being done.
This is Doug Smith for Dugan Daily.